For coming out tonight. It's really great to see such a large crowd for such an important event. I'm Rory Linane. I'm a reporter with USA Today Network Wisconsin, and I've been the lead reporter on our Kids in Crisis series on youth mental health, which you may have seen in the Green Bay Press-Gazette. It was out of this reporting that we decided we had to do an event like this, because we realized that mental health and suicide are still really difficult for people to talk about, unfortunately. There are stigmas that persist, and it makes people uncomfortable. But we know that it's really important that we're able to talk about mental health as a community, that we're able to say the word suicide in order to get better and be able to help each other. So I'm really happy that we have two trainers here tonight from the Brown County Coalition for Suicide Prevention, and they're going to do a QPR training, which will help you learn how to respond when someone you know might be feeling suicidal. Before we get to that, I want to tell you all a little bit more about the Kids in Crisis series, and then you'll be hearing from a few speakers about some of the local resources in mental health. Then you'll have the training, and we encourage you all to stick around after to learn about some of the resources we have outside and connect with each other. So the Kids in Crisis series began early last year with the Wessner family, who lost their son Jonathan to suicide. They were really brave in sharing their story with us and had no idea all of the outpouring of support that they would end up getting after this story ran. And we had no idea how many other families would end up coming forward to tell us about kids that they lost or how worried they were about their own kids. But families did keep coming forward because they wanted to make sure that their kids were safe, and they didn't want to see any more suicides happening in their families. And this is about the first year of the series.
His own life 343 days ago.
USA Today Network Wisconsin's series on teen suicide started with one brave family's story. The Kids in Crisis project grew into a movement, with families and experts around the state joining our call to better support struggling youth.
In honor of my daughter Morgan, I will continue to help in any way that I can because it's what she would want me to do.
Our series has involved 44 stories, but it is not confined to the pages of the newspaper. We held 10 town hall meetings throughout the state with more than 800 people who brought more than 200 questions. We proposed 5 solutions to teen suicide and made one pledge for change, which we took to the state capitol in a call to action event. Our series was recognized by Pointer for its engaging approach. But what really makes us proud is that the work is valued by our communities and the people who shared their stories with us.
We'd like to thank USA Today, along with Jim, Rory, and Liz, for taking the series of Kids in Crisis to the next level. Now let's start saving our children.
So this series wouldn't have been possible without the underwriting support of Bellin Health, and today we have Sharla Bannon here to talk about that.
Thank you, Rory. As Rory said, I'm Sharla Bannon. I'm the president of Bellin Psychiatric Center here in Green Bay. It is my honor to be here tonight, and it is our absolute honor as a health system to continue to support the Kids in Crisis series from Gannett USA Today. From the start, Kids in Crisis has been making a difference. It has ignited the conversation about children's mental health in communities throughout the state, and has motivated communities and leaders to act. But we all know there's more to be done. One of these actions is to continue to educate and empower our communities to recognize the signs of suicide risk if they are present. Tonight I'm very happy that we have 2 excellent QPR trainers here to provide a brief session for all of you and to impart the knowledge that may make a difference in someone's life. We are fortunate to have a very active coalition for suicide prevention here in Brown County. To date, our coalition has organized and provided QPR training to over 20,000 Brown County residents. Thank you to all of you also for taking the step to be here tonight and to learn what you're going to learn tonight to continue to support the health and well-being of our community. Thank you.
Thank you, Sharla. So when we started off reporting, we found a lot of troubling statistics. We found that 2 in every 20 Wisconsin children experienced major depression in the past year, and 1 of them didn't receive treatment. We found psychiatrist shortages in every county. Many counties didn't have any licensed child specialists. And we found large caseloads in schools. In the recommendation column, you can see how many students there are supposed to be for each one of those professions, and on the right is how many we actually had in Wisconsin in the 2015-16 school year. But we also sought solutions, and we found that there were psychiatrists who were using video chat in order to be able to reach patients all over the state. There were primary care doctors who were learning from psychiatrists how to help their patients with mental health issues. And most inspiring, we found many youth who are willing to share their stories with us in order to break stigmas and allow other youth to come forward. We put together an editorial with 5 solutions that we thought would make our state better for youth mental health. And we had a call to action event in Madison to promote those. And this is a pledge that we put together, which has signatures of people all over the state, including some lawmakers and top state officials. And now we've been seeing change happen. The state superintendent actually put forward a plan to increase the number of social workers in schools, to allow more clinics to set up in schools, and to allow for more training for staff to be able to recognize mental health challenges in their kids. And the governor as well has included these in his budget proposal. So one of the things that Walker proposed was to include all of the superintendent's proposals for schools. That's $6 million for all of those things combined. And he also proposed building a new crisis center for youth stabilization in order to reduce hospitalizations, and more consultations that allow primary care doctors to get advice from psychiatrists, and more mental health services in youth prisons. And also to end the Medicaid waiting for long-term waivers. So we're not done with the reporting. We have a whole second year coming, and we hope that you stay tuned. We had a newsletter sign up out there, and if you missed the sign up, feel free to raise your hand, and someone will come around with a clipboard. Otherwise, you can also sign up for that at the end. And we're also doing a video contest this year. We're hoping that youth and young adults will submit and answer the question what they wish society understood about youth mental health. And there are flyers about that at the table out there as well, or you can come talk to me if you're interested. So next we have Jess Reedy, and she is from Wisconsin Family Ties.
Hi, I'm Jess Reedy. I'm a parent-peer specialist from Wisconsin Family Ties. Wisconsin Family Ties is a parent-run statewide nonprofit organization based out of Madison. Wisconsin Family Ties' mission is to enhance lives by promoting children's mental health. As a parent-peer specialist, I support families that have children in their home that may be experiencing social, emotional, behavioral, or mental health challenges. I also have a booth out there if you need any more information.
Thank you, Jess. And to talk about another important organization, we have Tabatha D here.
Hi, I'm Tabatha D. I'm part of Collective Impact of Children's Mental Health, which is under the Wisconsin Department of Health Services. Collective Impact is made up of parents and youth, and we work hand in hand with state agencies. We have one common agenda that is coming together to define the problems that create a shared vision to solve it. It's a framework to take deeply of a complex to solve social problems. I chose to become a collective impact partner because I have 4 children biologically. I have 1 stepchild, 3 of which have mental health challenges, 2 have autism, and I wanted to be their voice. I didn't have support. I didn't have anybody, so I wanted to be heard. I met somebody at a conference, and she saved my life. And this is what I'm doing every day to help somebody, and this is what I want. And Collective Impact has helped me to be heard, and I want to do that for families out there. So if you want to, we're looking for more youth, we're looking for more parents and young adults to be part of our program, to be heard as well. You can look for us in the back if you'd like more information. Thank you.
Thank you, Tabatha. And last, we have Barb B. She is from the Center for Suicide Awareness, which runs the Hope Line.
Good evening, everyone. I'm Barb B. I'm the Executive Director of the Center for Suicide Awareness. We are nestled in Kaukauna, Wisconsin, but we run the statewide text line. If you haven't heard about Hope Line, here it is in the simplest form. At any time, 24/7, 365 days a year, you can text, not talk, text. Any of you that have teenagers, you want to get their attention, you don't call them, you text them. And that was the initiative we took about working with kids in crisis. Our kids can stay on that line every day for as long as they want. Average text is about 3 hours. We have about 100 kids that text the line per day. One of the key times of our texting is either midnight or 11:30 during the school day because it's lunch hour. Last year, we had 29 of our youth start their active suicide attempt, and because it's a texting, what do we have? GPS location, and saved all 29 of those kids before they died. So we prevent suicide every day. We have a booth out there. Please take materials. Please put that line in your kids' cell phones as well as your cell phone. It's not just a suicide text line. It is for those days that we all struggle. It's those days that we have breakups. It's those days that we just call life hard. So it's a free service. There's no charge associated with it. Thank you.
All right, thank you, Barb. And now I'd like to invite our trainers up here. We have Andrea Schultz and Chelsea McGuire.
Hello, everyone. Can you hear me? Yes. I'm a loud talker, but I don't think I can reach the end of the room. I'm Chelsea McGuire. And our PowerPoint is having a life of its own right now, so just 1 second.
What is it?
Pretend you're not seeing this. I want to keep you in suspense. You're getting all the answers for the myth and fact.
There.
while she's doing that, I can introduce myself because I have a mic too. My name is Andrea Schultz, and I'm the Injury Prevention Health Educator with Brown County Public Health, so welcome everyone. And I can actually talk for just a minute. Rory had asked us to share some of the work that our coalition is doing in Brown County, and I think it's very relevant to what we're talking about tonight. So, what the Brown County Coalition for Suicide Prevention does is we look at data in terms of what's going on with suicide in our community, and as we learn, we adjust our strategies so that we can really meet the needs of our community and that we can fill in any gaps that we might be seeing, and trying to really sort of meet the needs of our community and look at what groups might be most at risk and help them. So with that in mind, we have a number of standing committees and ongoing projects that I wanted to let you know about. The Be the Light Walk. Has anyone attended the Be the Light Walk? Yeah. So that happens every fall in the Green Bay area. And so that's one of our ongoing efforts that we have throughout the year. We also have a gatekeeper group. When we say gatekeeper training, QPR is actually a gatekeeper training. And it's meant for early identification and awareness so that you might know if someone is struggling with thoughts of suicide or if they're functioning in crisis mode. There's another training that we also use in our school systems in Brown County, and that's called SOS, or Signs of Suicide. So we use both QPR and SOS to try and reach as many individuals as possible in our community. And we're also currently exploring mental health first aid as a training that we might be looking to implement even more so in our community. So in addition to the gatekeeper group, we also have a group that's focusing on middle-aged men, veterans, and our law enforcement community, and how we can bring all of those groups together to bring down our suicide numbers in those at-risk groups. And we are looking also at how can we support in our community survivors of suicide. So when we say survivors of suicide, we don't necessarily mean someone who has themselves attempted suicide, but they might be affected directly by suicide. So they might be the loved one of someone who has died by suicide. And then our last ongoing initiative that I wanted to talk about is our Youth Initiatives Committee, because obviously that's why we're here tonight. And so, Chelsea, tell me if I forget any of these.
Absolutely.
But we are really looking at moving upstream and doing some suicide prevention awareness, but also looking at mental health concerns amongst our youth in Brown County. And we're looking at non-suicidal self-injury, bullying, and other topics that are related to those deaths by suicide in our communities. Some specific strategies that we are considering would be increasing the number of schools and the number of students who are participating in that Signs of Suicide curriculum that we mentioned, increasing the number of staff who are within schools, and educators, social workers who are aware of suicide prevention and early identification of mental health concerns. As I mentioned before, the mental health first aid curriculum is one that we're exploring, as well as Text Talk Act. And we're also really looking to up the numbers of youth who are engaged in the Be the Light Walk every year. We're looking at peer-driven empowerment and education activities within our school districts, as well as parent and parental involvement. So for the parents who are in the room tonight, thank you for participating in this important training. We're also looking to partner with local LGBT advocacy groups because of the higher risk that LGBT students do face for risk of suicide. So I believe those are the main components that we're looking at for the coalition. Sharla, Chelsea, fill me in if I am missing anything else.
No, I think we're good.
Yeah, so I think Chelsea was going to do an introduction to QPR and what it is, what it means, and to give you an introduction.
So show of hands, who here has been trained in CPR? Basically everyone, right? Because the idea is if someone is choking, you can save their life by using CPR. QPR is the same thing, although I don't have a weird dummy that you only need to breathe in tonight, so you're lucky. QPR is a way to save everyone's life. Anyone here know what QPR stands for? I see a hand right there.
No cheating in the front row.
Question, persuade, refer. And we are going to go over how you can learn all these steps and save a life by suicide tonight. Okay, so I have a few disclaimers. QPR is not intended to be a form of counseling or treatment. If you want to be a counselor or a therapist, go to college for it, come work with us here in Green Bay, the more the merrier. What QPR is intended is to offer hope through positive action. Hope is the only emotion stronger than fear. I did steal that quote from the Hunger Games, but it's so true. If you have hope, you can get through anything. You know, and I say that flippantly, but it's absolutely true. Hope is what gets us through. Hope for the future is what gets us to tomorrow. And that is what we are going to help you get to through QPR. Okay, know your resources. This is the part of the presentation where I encourage everyone to take out their phone. I hope you've already got the Hope line in there because texting is way better than talking on the phone. But I also would like you to put the Brown County Crisis Center number in there and the National Suicide Hotline if you'd like. You may never need these numbers. I hope you don't, but you might someday. And if you do need them, you'd rather have them in your phone than trying to Google it somewhere where there's inevitably no Wi-Fi. You can call the Crisis Center if you're having thoughts of suicide. You can call them if you want to know where you can go see a therapist, and you can call them if you're having a bad day in one event. I worked there for 7 years, and there is no problem too big or too small. People are there and they want to help you, just so you know.
And I just wanted to add, Barb forgot to mention that Hope Line is now available in Spanish as well as in English. So for those of us in the room who have friends or counterparts who would be able to text more easily in Spanish, that's also an option as well.
It's called Apoyo.
Apoyo.
Awesome.
All right. So before we move into the QPR presentation itself, we just wanted to give you a little bit of information statistically about what suicide looks like in Brown County. And we're going to go back to 2014 to just share some high-level data with you.
Yeah, because we're here because suicide is not an abstract thing. Suicide is real. It happens here in Brown County. It happens to people that we know and people that we love. For example, in Brown County in 2014, there were 34 total deaths. Think about that. Those are all people who we know, we love, people who were community members who were contributing to our world here, and they are now gone. You know, that's really terrible. Of those 34 people, 71% were male and 79% were middle-aged. Those statistics are accurate on the state level as well as the national level. As a general rule, middle-aged men is the group that is most likely to attempt or complete suicide.
Although I always have to point out, I am not too keen on the 30 to 60-year-old being middle-aged because I'm very far into that category, and I don't know that I love being called middle-aged, but it does give you the idea that, you know, there are definitely trends that we can look at, that we can see, and it helps us know who we should be talking to in our community.
All right. About 38% of people had a prior suicide attempt or prior thought to suicide attempt unknown before they took their life. And that makes me sad on many levels because that 38% of people we could have potentially reached out and helped. The method used is primarily self-inflicted gunshot wound, overdose, or hanging. And in 2014, we had 3 teens, 18 years old or younger, who ended up taking their lives, which is, suicide is never nothing less than a tragedy, but youth makes it even more so. Lastly, 18% were veterans, and we had an interesting sort of spike in professional occupations. All right.
So at this point in time, we're going to stop the live feed because if anyone is interested in getting this QPR training, we really want you to take advantage of that training in person. And so we, for those of you online who are watching, please reach out to the Brown County Public Health Department or to Family Services.
Family Services Crisis Center.
The Crisis Center or Public Health will be able to connect you with one of us or with another qualified trainer, and we'll offer that free of charge to any agency or any group that might be interested. But as of right now, goodbye Friends Online, and we're going to move into the training itself.